Hi, and thank you for joining us this morning. I'm Mitzi McFatridge, the Interim Executive Director at Kansas Advocates for Better Care, and Kelly Sommers is joining me this morning, and we're talking about temporary nurse aides, or temporary aides, I should say. And we're also going to talk a little bit about certified nurse aides and licensed nurses and what the difference is when it comes to their ability to provide safe and competent care to older adults who are in long-term care facilities, whether that's a nursing facility, assisted living, home plus, residential health care facility, or some other setting that is residential that provides care. So I want to just introduce Kelly Sommers a little bit. Kelly is a nurse, and she has a bachelor's of science in nursing, and she's also a registered nurse. She has great perspective. She has been a nurse. She has been a practicing public health care nurse. She has been somebody who trains certified medication aides. She's been somebody who supervises nurses and aides in care settings. So she has a wonderful perspective that she's going to bring today about the importance of training and competence and how that affects the care that older adults who are being cared for by folks end up getting, whether that's good care, whether that's not so good care. And so Kelly is going to join us today to talk about a few things related to that. So Kelly is the director right now of the Kansas State Nurses Association. And in that role, Kelly's going to talk to us just a little bit about what KSNA is and does.
Thank you, Mitzi. For ourselves, for KSNA, Kansas State Nurses Association, we're actually constituent members also of the American Nurses Association, or ANA. And the mission of KSNA is to protect and enhance registered professional nursing practice in all environments to assure quality. So when we're talking about quality, we're talking about quality, affordable, and accessible health for all of the people within Kansas. So it's our continuing work and effort to advocate on behalf of nurses and to advocate on behalf of the people we serve, because nurses are holistically, part of being a holistic nurse is to be an advocate of those that we serve right now. So I have been very involved with legislation. I appreciate Mitzi giving me the opportunity to speak today to everyone, to just talk a little bit about the nursing role, to talk about what's going on with this TNA position. So thank you, Mitzi.
Kelly, there are a lot of different staff in nursing and assisted facilities. There's dietary, there are hands-on caregivers, there are nurses, there's maintenance and housekeeping. So can you tell us a little bit about who typically provides the hands-on care and assistance that older adults receive when they live in a nursing or assisted type residential care facility?
Yes. The only people who should be providing hands-on nursing care, which is skilled nursing, would either be a CNA, so they have passed and they are now certified. So they passed that exam to become certified. They also have had hands-on direct supervision during this teaching process. Then we have the licensed practical nurse, or an LPN, and the LPN has had then continuing education where they continue to provide that licensed care, but it's on a different level on top of what a CNA does. Then we have the registered nurse, or an RN. A registered nurse or RN has their bachelor's degree and has even more education and the ability to supervise and to teach the LPNs and CNAs and further their education or knowledge, and to pass on information to everyone who's watching this video too, so that we can educate, let's say, family members regarding medications or the individual themselves. And then finally, we have the physician, and the physician provides the hands-on care, and he's the one that, or she, does the diagnosis.
So Kelly, everybody that you're talking about has a different level of education and training, and some people are required to be supervised by others of those. Can you talk a little bit about the differences in training between nurse aides and LPNs and RNs, and what the role of supervision is between all those?
Yes, thank you. So the CNA receives in Kansas 90 hours of education. So that's about 2.5 weeks if they're going full time with education, where the registered nurse provides all of that education and supervision. So when we're looking at a registered nurse, or sorry, when we're looking at a CNA, that CNA is being taught those hands-on skills. For example, lifting someone or transferring someone from their bed to their chair, or vice versa, or assisting with showers, assisting with meals. So it's that hands-on skilled care, but within their certification process. And there is a scope that we all practice under. A licensed practical nurse has had continuing education outside of that, where it can be about a year's worth of education. They can additionally provide that same skill level that a CNA has, but they also have other skills that they can perform that have been taught by the RN first, and this plan of care has been established. So when we look at, let's say somebody has a wound that's going to require a dressing change every day or two, it's the RN who's responsible for teaching that LPN and to put together that plan of care. So that whole process is there, and the LPN can do the dressing change and also look at if there's any areas of concern that needs to be reported to the registered nurse. And that's an example of something that a CNA can't do, but an LPN can do. And then the registered nurse, which I've mentioned a little bit here, is part of that whole education process. They supervise the LPN and the CNA. They have additional pharmacological education. A registered nurse is the only person who can do the full assessment of an individual. They take the doctor's orders, put that into the plan of care. They're going to do the teaching of medications. I mean, there's just a plethora of additional information. We actually have classes that are taught to us in care that's provided directly to seniors too. So luckily with the registered nurse, if you're looking at long-term care, they've had that additional training that needs to be in place for everyone. I hope that explains it well enough.
I think that's great, actually. It's really good to know the kinds of education and training that an RN has had and an LPN has had and a CNA has had, because obviously that all translates into the kind of care and the quality of care and the competence of care that older adults that are living in care facilities are going to end up getting. And it's good to know that CNAs who may not have as much training as an RN or an LPN have supervision from them and training from them in the facility once they complete their certification, classroom training, and clinicals. So that's great. Thanks for explaining that to us a little more.
Sure.
In 2020, when the pandemic, the COVID pandemic really set in, there were a lot of us that were challenged by COVID in a number of different ways. Some of us got COVID and were out from our jobs because of that. Some of us had children who couldn't go to school, and so we were out from our jobs because of that. And that all had an impact on who was in a care facility to provide hands-on care and assistance every day to the older adults who are living there and who need that care. Right. So in Kansas, there was an authorization for this emergency that allowed for temporary aides to begin to provide care. And the temporary aides aren't trained in the way that nurse aides are, and they're not trained in the way that registered and licensed practical nurses are, but they are providing hands-on care to older adults. So can you talk to us a little bit about how many hours of training a temporary aide is supposed to have, and whether or not anybody is actually supervising their work in a care facility in order to assure that older adults are getting the care that they need?
Thank you for that very good question, because that's something that we have been advocating against right now is the temporary. They actually are calling it nurse aide. And I'll tell you the concern with nurse, when you say nurse aide, is the assumption is there when we all hear nurse aide that that person has been certified. That person has not been licensed, has not passed any certification. What is happening is there's an 8-hour online unsupervised course that a person takes where they're watching videos, which actually is cross-training them in what a CNA does. And then there's a 50 multiple choice question at the end that additionally is not being supervised. And I did have a lot of questions, some that are still unanswered, that we should have answers for regarding this whole process, so that we know what is happening, who's supervising, who's holding this position accountable, and what it is that everyone should know about this position and should be informed about. So if we're not informed as a registered nurse, then we know no one else is being informed either. So this person actually is learning some of the skills that have been taught to a CNA who's had a lot of training, versus them coming in and, let's say, getting 20 hours of, I wouldn't call it just training, but it's a checkoff list. And those areas where they're talking about activities of daily living. But we have to remember, activities of daily living does require a skill. So when somebody is, let's say, transferred, I've talked about this earlier, like transferred from even a bed to a chair, okay? It's not that simple, and that's not the complete definition or skill base, because we all know, depending on if somebody has a disease process, we know that when we all get older, we have some frailty, we have changes in our bones, that we need to be lifted and transferred to a chair in a certain way. Sometimes we need assistance too. It can't be just one person. It has to be more than one person regarding this position. I asked who was directly supervising this position, because we need to know. And my answer was it was not the long-term care. So ultimately it falls on the LPN and the RN. And my question is whether the LPN or RN has even been informed properly on what it is that position, that TA, TNA, whatever we want to call it, that they know what it is, that it's well defined. And I don't think the position is well defined. I know the position is not well defined at all. And it's good that we're talking about this right now, because people have the right to know what's going on regarding our care or the care of our family members too, because I don't think the public has been well informed about this at all regarding this position.
That's really helpful information. One of the things that I wondered about and asked about, is there anything that identifies somebody who's a temporary aide to the resident who's receiving care from them? Because residents and families assume that anybody who's an aide has had 90 hours of training, which means they've had 45 hours of classroom training and 45 hours of clinical training. And there's an extensive checklist of skills that they have to demonstrate. Unlike for a temporary aide who has the 8 hours of online training that's unsupervised and not classroom instruction, and that they don't necessarily have somebody supervising their work in the facility that's a registered nurse, because there aren't registered nurses in the facility 24 hours a day,
No.
7 days a week. So I think those are really important distinctions for people to understand, that somebody may be a temporary aide, there may be no designation of that, and that people won't know that who are receiving care from them. So one of the other things that I think is really of concern, both for the aides and the residents, is there's certainly been research that people who receive less training as aides are more likely to be injured, and they are more likely to injure an older adult that they might be taking care of. Is there anything that you'd like to say about that kind of training and how to better protect older adults and aides?
Well, the best way I would say to better protect older adults and, for family members, your loved one too, is to not have that temporary aide in place right now. Unfortunately, right now, we have not even as advocates had a choice in this process either. So what we've been advocating then on behalf of KSNA is, if we're going to bring a TNA into this position, then ultimately they need ongoing training so that they can earn their certified nurse aide. They can't become stagnant in this position and say, I've had this 8-hour unsupervised course, 20 hours of very lax, not enough training to be called a TNA, and that they get ongoing education, that classroom education, get that ongoing one-on-one education that is all supervised, so that we can then have the quality of care that everyone deserves in this position right now, because it will not exist unless we do that. And COVID really, you see there's been decreased numbers of people who are now working in long-term care. And the best way to solve that is actually, if we're going to have this position's in place right now until January of 2023. There's no explainable reason why this person couldn't have their education paid for by the long-term care facility, and for that person to get the certification that's needed to provide quality care right now. And I would also say, when I've looked at other states too, because I know CNAs crave additional education too. So this 90 hours actually really should be extended at least 100 or not more, and really let's get some really specific training to geriatric care too. And I would actually implore that happens on the LPN side also, because there's not that specific training to the populations that we would provide care. And it's just absolutely necessary. I can't walk in from working in, let's say, public health or even working at a hospital where I was delivering a baby, and come into a long-term care and provide the best care that I possibly can. And I'm going to want it. There's not one person in that position who won't say, I need that education, and I need that ongoing education. It doesn't stop at a certain period of time. This is an area, this is our seniors. This is going to be you and me. This is our family members, and we should require and demand that what's necessary for everyone right now. And I can't emphasize that enough. And we do have states who've done this and really modernized their approach to education right now. And I would like to see that happen for Kansas also.
I think that's really important, because the training that nurse aides receive has really come since the 1987 nursing home reform law was passed. And much of what's in that training was really, in the training curriculum, was really set forth a long time ago. And so we know that we have more older adults who have Alzheimer's and dementia challenges. We know that there's an overuse and misuse of antipsychotic drugs, especially on older adults with dementia in Kansas facilities. And so getting some, as you're saying, geriatric specific treatment and training would be really helpful to the kind of care that older adults would be receiving in care facilities. And you also mentioned that this temporary aide position has been reauthorized by both the governor and the legislature to run through January 20th of 2023. And I know that there's been conversation about the fact that because we are short-staffed in nursing homes, maybe we should look at continuing on the nurse aides or grandfathering them in some way. Part of my concern about that has been really twofold. One is we have better options. And two, if somebody has gotten inadequate training, grandfathering in the work that they've been doing in some ways might just be reinforcing doing things incorrectly or unsafely. So I have some concern about that. But on the other side, I do know that a number of facilities in Kansas have gone the path of what they refer to as universal workers, so that every person in the care facility goes through the certified nurse aide training. So that means that you might be working in the kitchen or dietary or activities or housekeeping or maintenance, but you will have been through the certified nurse aide training. So if there is an older adult that needs your help and the facility is short-staffed, any person in the facility could actually help when the help is needed. And that would certainly be a better approach, I think, to the kind of care and the quality of care that older adults would receive, and also the safety for those who are working in the facility. And another approach that some states have used during the pandemic have been called essential caregivers. So they've actually offered family members who have been involved with older adults, at mealtime or in other ways, to come in and to do some of the things that temporary aides have been allowed to do. And going forward, that might be a much better choice for us if we think about how we can supplement the shortages in facilities. I certainly agree with you that we have to look more closely at the training that people receive, the circumstances that they find themselves working in, the supervision and the training that they are able to get, and the compensation that they're able to get, because those are all concerns that have been raised by people who are leaving nursing home care, and especially during this really difficult time. So anything else that you'd like to say about other approaches that we might want to look at, or any other concerns about taking this temporary aide into the future?
Well, I can tell you right now that if a bill was put forward in 2023 that wanted to allow this TNA or TA position to be a permanent position in long-term care, it should not be supported by anyone. We don't want ourselves to support something like that. We don't want our families to support something like that, that honestly should not be there in the first place. And I also, what I didn't mention is, with part of that process is that, we're having individuals come in right now too that aren't fingerprinted. And for certified nurse aides, for LPNs, for RNs, we have to be fingerprinted. We have to have, so that they're looking at us before we're even in. For myself as an RN, I didn't get a license until I had been fingerprinted and it had been ran as part of a background check to make sure that I had not had committed a crime. And because we all deserve, we have rights and we have choices. So this TA's coming in without being fingerprinted and can come in, work long-term care, no fingerprint, and are allowed 60 days to get that background check in place too. So we can't support a position that has not been held to the high high quality standards that everyone deserves right now. We know that if we're looking at people who've already been there past that 60 days and have received the additional training that you were talking about, where they get that CNA if you're working in the kitchen or whatever else, would be fabulous, would be absolutely fabulous. So if you have a shortage, that trained certified person who has had a background check, who has been fingerprinted, can provide that hands-on care that's needed right now. And so I love that you brought that up right now, because I think that's going to be the best solution moving forward right now too. And like I said, if we're going to have these TNAs in place, and I'm sorry, but I always want to correct the nurse aide position, because nurse aide is an assumption that somebody is certified in the state of Kansas. So in the state of Kansas, if you use certified aide, the assumption is there that that person has been certified. So this temporary nurse aide has not been certified. And I just want to make that clear. So if we're going to bring in these temporary nurse aides right now, first, they need to be fingerprinted. They need to get that background check. And I would ask that a background check be done prior to this person coming into work in long-term care right now. And then the requirement would be within a specific amount of time that that person then receives their certification through a CNA, through the adequate courses and the adequate training and the adequate testing that has been supervised by a registered nurse. So I hope that's helpful a little bit.
It is. And Kelly, we're talking a lot about the credentialing, the background check, the qualifications, and all of that is important because it really impacts whether or not a nurse knows how to debride a bed sore, or if a nurse aide knows how to safely move an older adult from their bed to the bathroom, or their bed to a chair, or to help them walk down the hall to avoid falls and injuries and fractures. So it's not just about rules and regulation. It really is about the quality of care that we know that fragile older adults are in need of. So I can't tell you how much I appreciate you taking the time today and helping us all learn more about the roles of the different care providers in care facilities. And thanks for helping us understand more about temporary aides and what they do know and what they don't know in terms of providing care to older adults. So we really appreciate you joining us today, and thanks so much.
And thank you, Mitzi, for all of your advocacy that your association does too. And I would just like to remind people, you have rights, you have choices within your care. You have the right as an RN to know the information that is out there, to know the pharmaceuticals that somebody takes, to know what food somebody's eating, how well an individual is doing. And so just moving forward, don't be afraid to ask those questions, because those questions are what you deserve. And if you have a question in your mind, that's a question you should ask verbally. Thank you.
That's great, Kelly. Thanks so much. And of course, for anybody that's listening, you know that you can call Kansas Advocates for Better Care or email us anytime with your questions, and we will always respond to those. So again, thanks so much, Kelly, for joining us.
Thank you. Thank you, everyone, for watching.